Your kidneys may be in trouble long before you feel seriously ill. That is what makes kidney problems so easy to miss. You may feel a little more tired than usual. Your shoes may suddenly feel tighter. You may wake up several times during the night to use the bathroom. You may notice bubbles in the toilet and think nothing of it. Most people blame these changes on age. But sometimes, your body is trying to warn you that your kidneys need attention. Your kidneys work quietly every minute of the day. They clean your blood, they remove waste, they control how much water and salt stays in your body. They help control your blood pressure. They also help your body make healthy red blood cells. When your kidneys begin to struggle, many parts of your body can be affected. Today, I will show you 6 signs that may appear when your kidneys are not working as well as they should. Make sure you stay with me until number 1. It is a sign that may appear on your face every morning and disappear before you think to question it. I am Dr. Adrian Mercer, and on this channel, we make healthy aging easier to understand. Before we begin, please remember something important. Having one of these signs does not mean you have kidney disease. These signs can happen for many different reasons. Only a proper medical check can tell you what is really happening. This video is for general education. It is not a personal diagnosis. If you are worried about your health, speak with a qualified healthcare professional. Now, let us begin with number 6. Number 6 is feeling unusually tired, weak, or mentally foggy. Everyone feels tired from time to time. You may feel tired after a busy day, a poor night of sleep, or an emotional week. That kind of tiredness often improves after you rest. The tiredness connected with poor kidney function may feel different. You may wake up tired even after sleeping through the night. Simple jobs may begin to feel difficult. Walking to the kitchen, getting dressed, or carrying a small bag may take more energy than before. You may also find it harder to think clearly. Perhaps you lose track of a conversation. Maybe you walk into a room and forget why you went there. You may struggle to focus while reading, watching television, or paying a bill. It is easy to blame these changes on age, but they should not always be ignored. Your kidneys clean waste from your blood. If they are not filtering properly, some of that waste may remain in your body. This can make you feel slow, weak, tired, or confused. Your kidneys also help your body make red blood cells. Red blood cells carry oxygen around your body. When kidney function becomes poor, some people develop a condition called anemia. Anemia means that the body does not have enough healthy red blood cells. Without enough red blood cells, your muscles and organs may not receive as much oxygen as they need. You may feel weak. You may become tired very quickly. You may feel cold when everyone else feels comfortable. You may also become short of breath after doing something that was once easy. Of course, tiredness has many possible causes. It can be caused by poor sleep, stress, low iron, low vitamin B12, thyroid problems, infection, heart problems, medication, or not eating enough. That is why you should not try to diagnose yourself from tiredness alone. But if you feel tired every day and rest does not help, speak to your healthcare professional. Ask whether you need blood tests, including a test of your kidney function. Do not accept constant exhaustion as a normal part of getting older. Your body may be asking for help. Now let us move to number 5. Number 5 is dry or itchy skin that does not improve. Most people experience dry skin at some point. Hot weather, cold weather, strong soap, allergies, and not using enough moisturizer can all leave the skin dry and uncomfortable. But sometimes, ongoing itching may be connected with a deeper problem. Healthy kidneys help keep the right balance of minerals in your blood. These minerals include calcium and phosphorus. Your body needs the correct amount of these minerals to support your bones, nerves, and muscles. When kidney function becomes very poor, waste can build up in the body. The balance of minerals may also change. This can lead to skin that feels dry, rough, or very itchy. Some people describe the itching as feeling deep under the skin. It may be worse on the arms, legs, chest, or back. It can become more uncomfortable at night and make sleeping difficult. You may put on cream and feel better for a short time, but the itching soon returns. Once again, itchy skin does not automatically mean that something is wrong with your kidneys. Skin conditions, allergies, insect bites, medication, liver problems, and many other things can cause itching. The important thing is to look at the full picture. Are you also feeling unusually tired? Have your feet or ankles become swollen? Has your urine changed? Are you losing your appetite? Are you feeling sick without knowing why? When several changes appear together, it is time to speak with a healthcare professional. Do not keep scratching the skin until it becomes damaged. Scratching can cause cuts and infection. Instead, ask for help finding the real cause. Number 4 is a lasting change in the way you urinate. Your kidneys make urine by cleaning waste and extra water from your blood. Because of this, changes in your urine can sometimes provide useful clues about your kidney health. You may notice that you are urinating more often than before. This may be most noticeable during the night. Perhaps you once slept through the night, but now you wake up 2 or 3 times to use the bathroom. You may also feel a stronger need to urinate, even when your bladder is not very full. Other people notice the opposite change. They may produce much less urine than usual. You might also notice that your urine has become darker, cloudy, or a different color. A change in urination can have many causes. Drinking more water can make you urinate more often. Drinking less water can make your urine darker. Diabetes can increase urination. So can some blood pressure medicines. A urine infection can cause pain, burning, or a sudden need to use the bathroom. In older men, an enlarged prostate can make it difficult to empty the bladder. It may also cause a weak urine flow or frequent trips to the bathroom at night. One unusual day is not always a reason to worry. What matters is a change that continues. Pay attention to what is normal for you. If you suddenly begin urinating much more or much less than usual, and the change continues, tell your healthcare professional. You should also take blood in the urine seriously. Blood may make the urine appear pink, red, brown, or the color of tea. Blood in the urine can happen because of an infection, a kidney stone, an enlarged prostate, kidney disease, or another condition that needs medical attention. It may not cause pain. Do not wait for pain before asking for help. Blood in the urine should always be checked. If you cannot pass urine, feel severe pain, have a fever, or see a large amount of blood, seek urgent medical care. Before we continue, tell me in the comments whether you have ever had your kidney function checked. Many people have never asked about it, even though the test is simple. Now let us move to number 3. Number 3 is urine that stays unusually foamy. It is normal to see a few bubbles in the toilet sometimes. Urine may create bubbles when it hits the water quickly. Cleaning products in the toilet can also create foam. Dehydration may make urine stronger and more likely to bubble. The concern is foam that appears again and again. It may look thick. It may cover much of the water. It may remain in the toilet instead of quickly disappearing. Why can this happen? Your kidneys contain millions of very small filters. These filters remove waste while keeping useful things in your blood. One of those useful things is protein. Your body needs protein to build and repair muscles, support your immune system, and keep fluid in the correct places. When the kidney filters become damaged, some protein may leak into the urine. A protein called albumin can create foam when it mixes with urine, but you cannot tell whether protein is present just by looking into the toilet. A urine test is needed. If you notice foamy urine once, there may be a simple explanation. If you notice it regularly for several days or weeks, speak with your healthcare professional. This is especially important if you have diabetes, high blood pressure, heart disease, or a family history of kidney problems. Diabetes and high blood pressure are 2 major causes of long-term kidney damage. High blood sugar can damage the small blood vessels inside the kidneys. High blood pressure can also place too much force on the kidney filters. This damage may happen slowly and without pain. That is why regular testing matters. Ask your healthcare professional about a urine albumin test. This test checks whether protein is leaking into your urine. Finding the problem early may give you more time to protect your kidneys. Number 2 is swelling in your feet, ankles, hands, or lower legs. You may first notice this when putting on your shoes. Shoes that normally fit well may suddenly feel tight. Your socks may leave deep marks around your ankles. Your ankles may look larger at the end of the day. If you press a finger gently against the swollen area, the skin may stay pressed down for a short time. This type of swelling is sometimes called edema. Healthy kidneys remove extra water and salt from the body. When they cannot do this properly, fluid may begin to collect in the body. Because of gravity, the fluid often moves down into the feet, ankles, and lower legs. Some people may also notice swelling in their hands or face. But kidney problems are not the only possible cause of swelling. Swelling can also be connected with heart problems, liver problems, weak leg veins, infection, blood clots, or certain medicines. Some blood pressure medicines can cause swollen ankles. Sitting or standing for a long time may also cause mild swelling. That is why the pattern is important. Is the swelling happening every day? Is it getting worse? Is it affecting both legs? Are your shoes becoming tighter? Are you gaining weight quickly without eating more? Are you also feeling short of breath? These details can help your healthcare professional find the cause. Do not try to treat unexplained swelling by taking someone else's water medicine. Do not suddenly stop drinking water. Your body needs the right amount of fluid, and the correct amount is not the same for everyone. The safest step is to find out why the swelling is happening. Sudden swelling in one leg may be caused by a blood clot and needs urgent attention. Swelling with chest pain, severe shortness of breath, confusion, blue lips, or difficulty breathing may be an emergency. Do not wait for a normal appointment if those serious symptoms appear. We have reached number 1. Number 1 is puffiness around your eyes, especially in the morning. Most people do not connect puffy eyes with the kidneys. They may blame poor sleep, crying, allergies, or a salty dinner. Those are all possible causes. But puffiness around the eyes can sometimes appear when the kidneys are allowing protein to leave the body through the urine. Protein helps keep fluid inside the blood vessels. If too much protein is lost, fluid can move into the tissue around the blood vessels. The skin around your eyes is thin and soft. This can make swelling easier to see in that area. You may wake up with puffy eyelids or small bags under your eyes. The puffiness may improve later in the day. Because it disappears, you may forget about it. But if it returns every morning, pay attention. Persistent puffiness becomes more important when it appears with other changes. These may include foamy urine, swollen ankles, unusual tiredness, high blood pressure, or changes in urination. Take a clear look at your face when you wake up. Do your eyes look more swollen than they used to? Does the swelling happen almost every day? Does it improve after you have been standing or moving around? If so, mention it during your next medical visit. A simple urine test can check whether you are losing protein. Now here is the most important message in this video. Kidney disease often causes no clear signs during its early stages. You may feel completely normal while kidney damage is developing. You may still urinate normally. You may have no pain. You may have plenty of energy. This means that waiting for symptoms is not the best way to protect yourself. Testing is especially important if you are at greater risk. Your risk may be higher if you have diabetes, high blood pressure, heart disease, obesity, or a family history of kidney failure. Your risk also rises as you get older. There are 2 important tests you can ask about. The first is a blood test that checks how well your kidneys are filtering your blood. The result is often called your eGFR. Those letters stand for Estimated Glomerular Filtration Rate. You do not need to remember the full name. Simply ask your healthcare professional, how well are my kidneys filtering? The second test checks your urine for albumin. This can show whether protein is leaking through the kidney filters. The test is often called a urine albumin to creatinine ratio. You can simply ask, is there any protein in my urine? These tests work together. The blood test shows how well the kidneys are filtering. The urine test looks for signs of damage. One unusual result does not always mean you have long-term kidney disease. Your healthcare professional may repeat the test. They may also look at your medication, blood pressure, blood sugar, age, and medical history. So, what can you do after watching this video? First, do not panic because you noticed one sign. Many common conditions can cause these symptoms. Second, pay attention to changes that continue or become worse. Look at your feet and ankles. Notice whether your socks leave deep marks. Pay attention to foam or blood in your urine. Notice whether you are waking up more often to use the bathroom. Look for puffiness around your eyes in the morning. Do not ignore tiredness, itching, nausea, or loss of appetite when there is no clear reason. Third, ask whether you need blood and urine tests. This is especially important if you have diabetes or high blood pressure. Fourth, Take your prescribed medicine as directed. Do not stop medication because of something you heard in a video. Do not begin a supplement that promises to clean or repair your kidneys. Some supplements may contain ingredients that can place even more stress on damaged kidneys. Always speak with a qualified healthcare professional before making changes. Your kidneys do an enormous amount of work without asking for attention. They clean your blood every day. They remove waste and extra fluid. They help control blood pressure. They support your blood, bones, muscles, nerves, and heart. Protecting them does not begin with fear. It begins with paying attention, controlling blood pressure and blood sugar, taking medicine correctly, and getting checked when needed. Of the 6 signs we discussed, which one surprised you the most? Tell me in the comments. Your answer may encourage someone else to pay closer attention to their health. In the next video, we will look at common daily habits that may place extra stress on your kidneys and the simple changes that can help protect them. I am Dr. Adrian Mercer. Take care of yourself, and I will see you in the next video.